speaking, or rather briefing you on the topic of secondary infertility, the pregnant pause. What is secondary infertility? Basically, it is defined as the inability of a couple to conceive or give birth to a live baby in a couple who already has had a previous normal pregnancy or a delivery. Usually, common causes of secondary infertility can be divided into two heads, that is the male factor, which is the husband related factors, or the female factor, which is factors due to the wife. Firstly, I'll go defect in spermatogenesis, which means either there's a defect in the sperm counts or the sperm motility or some kind of secondary infection which may decrease the counts may be responsible for the male factor infertility, or it may be due to sexual dysfunction on part of the male partner, which in itself can be secondary due to chronic diseases like diabetes mellitus or other neurological disorders. Coming to the female factor, that is the wife, usually most commonly it is the age. Increasing age has a inverse proportion on the fertility. As the age increases, the capacity, that is the ovarian reserve of the female partner, goes on decreasing. Lifestyle, stress, poor diet, a sudden weight gain or a sudden weight loss, alcohol, smoking are other factors which may cause secondary infertility in a woman. Coming to the structural problems like uterine pathology, which can be in the form of uterine synecdoche, which means adhesions develop in between the walls of the uterus. Secondary in a woman who must have had a previous normal delivery, or other kind of uterine pathology like a polyp or a fibroid may be responsible for secondary infertility. It may also be because of certain ovarian pathologies like a residual cyst or a chocolate cyst, or the most common as many people encounter is polycystic ovarian disease, commonly called as PCOD. It may be due to tubal pathology. Our uterus has two tubes, one on the right and the other on the left. The tubes have to be patent in order that a couple conceives. So, tubal pathology in the form of a blockade may be the cause for secondary infertility. Blockade in itself may be secondary to certain pelvic infections like tuberculosis or other pelvic inflammatory diseases. So, briefly, in short, I have given you guys a idea about the reasons or the causes why a couple may have secondary infertility. Once you approach your gynecologist or your infertility specialist, they'll take you through, they'll take a short history of yours, and accordingly, they will make you undergo a few tests so as to pinpoint what is the cause for the secondary infertility. Usually, diagnostic tests include in the female partner tests like blood tests, like we go for the complete blood count, sugar test, hormonal tests like thyroid, prolactins, because hormonal factors are also responsible for secondary infertility. We usually advise a baseline ultrasound, that is the pelvic sonography, wherein we understand if there has been any other structural defects or new origin, something new, some new pathology that has that has given this problem of second infertility. Coming to the tubal patency, which I just discussed, tubal patency can also be tested, and we usually test it in two forms. One is the HSG, which is usually commonly called as the dye test, or also full form known as hysterosalpingogram. In this test, dye is injected through the cervix of the patient, and we check through X-ray fluoroscopy whether the tubes are patent or not via the delineation of the tubes. And the tubal patency can also be tested through direct vision on a laparoscopy. Now, what is it, laparoscopy? Basically, again, hysteroscopy, laparoscopy is a combined test which we usually do in patients coming to us for secondary infertility, in whom we have already ruled out the other causes of infertility, So basically, laparoscopy, hysteroscopy can be both diagnostic as well as therapeutic. When I say therapeutic, it means that it can be the treatment too. In this test, the hysteroscope and laparoscopy procedures will detect the pathology as well as treat it at the same sitting. And as far as the diagnostic test in the male partner is concerned, we go for a detailed semen analysis, which gives us an idea of the various functional parameters of the sperms. So once a diagnosis is made, we have an idea as to what factor is to be tackled, and accordingly, the treatment is initiated. Uh, Treatment is very simple. We always go in a stepwise manner to treat a couple coming to us. Initially, depending upon the pathology which has been corrected, we start stimulating the patient. Stimulation में simple चीज़ें जैसे कि tablets दी जाती हैं, and many times hormones भी आते हैं, hormonal injections. Depends upon the patient's criteria. We decide whether she is a good candidate to be stimulated on tablets or injections, or a combination of both or either. Accordingly, we do the ovulation study, which is also called as the follicular study. In this, we study are growing enough number of follicles or not, and in case the patient is producing follicles, whether they are growing or not, and in case they are growing well, we track whether it ruptures in time or not. And if it doesn't, then we have certain injections which are called triggers, which help the patient ovulate, and accordingly, either in the form of a planned relationship schedule, or we do a IUI, which means intrauterine insemination. Now, coming to IUI, I'll just describe it in short. IUI is most commonly done, हम usually उनमें करते हैं जिनमें हमको पता होता है कि male factor infertility is a primary cause. In this, the semen sample produced by the male partner is washed, processed, and the filtrate is injected into the cervical canal through a soft tube. It's non-traumatic procedure, doesn't require any hospitalization, and has good results. At least 30 to 40% pregnancy positive rate is there. So basically, once a couple comes to us, we find out what is the cause for the infertility, and accordingly, we give them the treatment options available. In case secondary infertility IUI fails, as we all know, IVF stays the final answer to it. So, friends, in short, this is a small gist of secondary infertility that I wanted to discuss today. I'm open to questions in case if there are any. Okay, so I have a question here. When should we see a specialist? See, by definition अगर हम जाएंगे तो जैसे मैंने डिस्कस किया, if a couple is not conceiving for 1 year, तब हम उसे secondary infertility कहते हैं. But if a couple who is already too high on the age side. For example, if there is a woman who is 35-year-old or even 37-year-old coming to me, and if she says that she's not conceiving in the last 6 months, she's been actively trying. So in such patients, I we don't have to wait for them to complete the 1 year period. The early the better. And especially if a patient who has had problems in conceiving in the previous pregnancies, they should not waste much time before seeing a specialist. We can go ahead to the next question. I have a question which says as what causes infertility. You see, right now I just discussed in short there are multiple factors which cause infertility. It may be either in the male partner or the female partner, or it may be a combination of factors in both of them. The basic idea behind treatment is to find out the cause and treat it. Next question. So yeah, this is a good question. How does age affect fertility? See, we all women, we are born with a fixed number of basically follicles. Follicles are the ones which become the future eggs, in short. So, as in when our age increases, the follicle count goes on decreasing. In short, the function of the ovaries जहाँ से बीज बनते हैं वो कम हो जाते हैं. So chances of us conceiving with the later age goes on decreasing, and therefore the fertility decreases. There's a good question. There's a question saying, how can lifestyle affect fertility? As I've already discussed, see things like alcoholism, uh, smoking, faulty diet, all these cause infertility. So basically, a healthy lifestyle helps maintaining a good body mass index. Not being on the overweight side or the underweight side is always preferable. There's a question which says, what should I expect during my first visit for infertility? In your first visit, basically, the gynecologist or the infertility specialist will be asking you a set of few questions to both the partners in order to assess the problem. Later on, we usually advise a set of tests to be undergone by both partners. And according to the test reports, we guide you through the further treatment and management. Why would a thyroid function test be done? Is the next question. See, basically, thyroid disorders are a common thing and they are a common cause of infertility. So, as a baseline test, serum TSH level is usually done in all of the patients who seek advice from an infertility specialist. Next question, if anything. Okay, that's a good question. How long does infertility testing take? See, infertility testing is not a single test. It has a panorama of tests, and we don't subject all the patients to all the tests. So basically, after the baseline tests are done, and if we happen to get a cause, we treat it. Otherwise, we keep on subjecting the patient to test, and accordingly, we may end up with a hysterolaparoscopy or something therapeutic in the hysterolaparoscopy. So there's no fixed duration that how long the testing will take. Otherwise, the tests are very simple. Few blood tests, few sonographies. It's hardly can be finished in a day or two. But not all tests will be advised to all the patients. Maybe go ahead to the next question. There's a question asking what does the basic testing for women include? As I said, the basic testing will include blood tests like commonly done is the complete blood count, the thyroid test, the sugars, and in case if required, we rule out few infections and a pelvic sonography. And in general, we do a basic ovulation study to know whether the patient is ovulating or not. And a test for the ovarian reserve, like the serum anti-Mullerian hormone levels, might be advised to you. Other hormonal tests like FSH, LH levels may be advised. That depends upon your clinical picture, your age, and how you present in the OPD to the clinician. Any more questions? And there's a question asking what is the purpose of tracking the basal body temperature. See, the basal body temperature may help you know the ovulatory date, but it's a very old test. Nowadays, patients are aware, majority of the patients are aware of the LH kit. LH kit is the luteinizing hormone kit which helps you know the day on which you're ovulating, which usually comes between the 12th to the 14th or the 15th day of your cycle. And all depends upon the length of your cycle. So, purpose of tracking basal body temperature is 100% to detect ovulation. But nowadays, we have better tests and tests with better precision, like the urinary LH test, which the kits are available freely available in the pharmacy. Any other questions? There's a question which is asking like, my partner and I are unable to conceive, what should I do? So this more of looks to be a case of primary infertility. Probably the couple has never conceived at all in the past. Again, as I said, we will be taking a brief history of both. You have to visit a physician, a clinician. They will take a brief history of yours. Physical checkup of both the partners may be done, and accordingly, few blood tests and sonography and semen analysis as baseline test will be advised to you. Yeah, this is a very good question. Who should I see first, an obstetrician gynecologist or a fertility specialist? See, it is up to you, whoever you feel accessible to, because primary line of diagnosis or say treatment will be, this can be catered by both of them, either a general obstetrician and a gynecologist who doesn't practice infertility at all, or you can directly go to a fertility specialist. Okay, so I think we done with the questions and no more questions coming up. So basically, secondary infertility, although looks to be like the pregnant pause, but in itself it's not a pause. We have tests available to diagnose the cause. We have treatment available to treat it, and at the end of the day, most of the required is visiting the clinician, seeking the advice, and following it. Thank you.